Today I'll be performing an intramuscular injection. First I will be starting off with my orders, which will be ceftriaxone 1000 milligrams over 3 milliliters times 1 dose. First I will check my MAR and my 5 rights of medication. So I'll be ensuring that I have the right medication. And I'll be also in the medication room. I will have my 1000 milligrams of ceftriaxone. But for demonstration purposes, it will be the demi-dose, which has 200 milligrams per milliliter, and it also needs 10 milliliters of fluid. And then I will have my normal saline, my 10 milliliters of normal saline, even though this one calls for 3 milliliters. For demonstration purposes, I'll be using the demi-dose. And after that, I will get a 12 milliliter syringe, which will help me and be appropriate for this administration. And I'll also be getting a 1-inch 23 gauge needle, and it is also appropriate for the administration of this medication. And then I'll also have some alcohol prep pads and a Band-Aid. And then I will check the correct dose. I'll be checking the correct medication, which is ceftriaxone, the correct patient, which is Mr. Disembodied in room so-and-so, and the right dose, which means I will have to reconstitute 1000 milligrams of ceftriaxone with 3 milliliters of normal saline. And then I will go to the right route, and the route says IM, which is appropriate for this procedure, and the right time, in which I will look into the MAR for the appropriate time. And the right documentation, ensuring that a physician or doctor has signed off on it and that it has been complete. It is in the next time is appropriate. And then I will begin to prep my material. First, I will prep my syringe and needle. And then I will release the cap on my 10 milliliters of fluid and release the cap on the unconstituted ceftriaxone. I will draw up 10 milliliters of air. Remove my needle. Insert my needle into normal saline, inject the air, flip upside down, draw up 10 milliliters of fluid, ensuring that my bevel is below the line of air. The needle, scoop method. Sure that I don't have any air bubbles. All right, 10 milliliters fluid. And since I have been talking over my unconstituted ceftriaxone, I'm gonna wipe it. Remove my needle. Start at 45. Then go to 90. my needle and then inject this. I'll do it in a circular motion and get it off the sides as best as I can. Now, before administering or changing over, I'll ensure that the normal saline is clear, within date, doesn't have any floaties or any indicators saying I shouldn't use it. And as I am refilling or reconstituting the ceftriaxone, I'll ensure that it's not clumped up, it's the appropriate color, and it is within date. And then as I am injecting the normal saline into it, I will also be assessing if it's a normal color, is there bubbling, or any abnormalities. I'll also be taking a little bit of air out to relieve some of the pressure in there. Then I'll remove my needle, recap. Now, for demonstration purposes, I would get a new needle, but for demonstration purposes, I will use the same needle. Then I will wipe off the cap. Draw up 10 milliliters of air. Actually, I will mix my reconstituted ceftriaxone by rolling it in my hands. Without shaking it vigorously. Then I'll make sure that the solution is mixed pretty well, ensure that there's no clumps anywhere. And then I'll wipe the cap, wipe off the top, draw up 3 milliliters of air from my intramuscular injection, uncap my needle, 45 to 90, inject the air, flip it over, then remove 3 milliliters of fluid.
That's all right.
My needle, recap, ensure that I don't have any air bubbles. Three milliliters of fluid. And then once I am completed with that, I will clean up my area, perform hand hygiene, and then I will go into my patient's room so I may check my fibrates medication again. So I'll be ensuring that I have the right medication, which is 3 milliliters with 1,000 milligrams of ceftriaxone within it, and then the right patient. Could you tell me your full name and date of birth? They're Mr. Sim disembodied in room so-and-so. And then I will I will inform my patient that I will be performing your doses of ceftriaxone intramuscularly. Could you tell me the last time, or if this is your first time having your ceftriaxone injection? And then they would tell me, and I would try to cycle or change sites on the patient. But since it's 3 milliliters, I can only do the ventrogluteal, rectus femoris, but they prefer not to do that, and the vastus lateralis. And the deltoid is inappropriate for this injection because it is 3 milliliters. And then I will check the dosage and ensure that it is 3 milliliters. And then I will also check the right route, and I will be doing an IM route in the vastus lateralis. And then to make sure that it's the appropriate time. And then I will perform the injection. But first I'll perform hand hygiene, put on my gloves. Then I will ask my patient to lay on their left side and slightly bend their knee so I can find the bony point of the hip, put my middle finger to the iliac crest, and then spread out my fingers and then inject into the ventrogluteal. Once I locate that site, I'll get an alcohol prep pad. Start from the injection site and out in a circular motion. And then since my patient, and then I'll make sure that it's laying flat. Then I will inform my patient that they will feel a small pinch. Then I'll go 90 degrees and down and inject ceftriaxone. Then I will hold it there for a moment. And I remove the needle. Engage the safety, but for recycling purposes, I won't do that. Then I will find the indication for needing a Band-Aid. For demonstration purposes, I won't be putting a Band-Aid on this, but I definitely will wipe and put a Band-Aid on. And then I will check my fibroids again, ensure that I use the correct medication on the right patient, which is Mr. Disembodied, and room so-and-so, the correct dose, which is 3 milliliters, and, excuse me, the correct dose is 3 milliliters, and the correct time, which is whatever time it is now. And then I will ask my patient, do they need anything? And then assess the injection site for any adverse reactions, asking my patient is okay. And then I will make sure the call is in place and follow standard precautions. Then I will go to the MAR and document the time, patient name and date, and the reaction to the injection. And I am done with intramuscular injection.